It's too early in the morning for me to be this frustrated, but let's talk about it. I'm a physician. I've practiced medicine for 15 plus years, and my eyes are being opened to what is happening. So I'll tell you another one of my own personal stories. My kid broke his foot. He broke his foot, and we went to an urgent care and got it looked at and found out he needed a walking boot. And you sign some form signing away your life saying that you'll pay for the walking boot, and they give it to you and you go on your merry way, and you think, well, my kid needed that, so of course I got it. I got the bill yesterday. First of all, my insurance declined to pay for the walking boot. I guess they thought his foot wasn't broken enough, like the two bones being broken wasn't enough to necessitate him having a walking boot. So the bill was for $209, and I thought, that sounds excessive. I looked up the exact walking boot on Amazon that you can purchase. You don't need to be a physician to purchase it. $108 to buy it on Amazon. But clearly in the moment when your kid has a broken foot, you trust the medical system. And you know that the seller on Amazon is also making money, right? So they are making money and selling it for $108. But when you are in your urgent situation and you need one now, the company that is supplying it to you is marking it up $100 even more. And I feel guilty because I have I've had people sign these things before saying they'll pay for medical equipment that I've provided when I've seen them for things like a broken foot. But I've also been blinded to the cost. I had no idea. There was no way for me to know how much they were going to be charged for the medical equipment. So this is just beyond frustrating to us as patients and us as physicians, right? Like, what is going on here? And just to be clear, whenever I have provided medical equipment, I'm never making a penny off of it. It's something that, I see my patient needs and we're providing it to them. It's not like I ever make any money off of it. So please don't come for me about this. But how do we make this better? And I do not have the answers, and I would love to learn more. I'll tell you what I'm going to do about this. I'm going to call the medical supply company. I'm going to call the healthcare company that provided the care. And I'm going to call the insurance. And I'm going to talk to them about it and just have some conversations. Maybe it makes no difference, but why are these three companies making it so hard for the everyday person to get healthcare they need? And again, before you come at me and be like, you're part of the problem, what are you doing? I'm trying to learn more. And I am starting my own practice that is a direct primary care practice that will have transparent pricing as much as I can possibly provide. And again, I'm sorry to all of you that have gotten these bills, because I know that everyone gets these bills. And it just does not make sense why healthcare pricing is not transparent.
Ha llegado el momento, me acaba de llegar la factura de cuando estuvo mi hijo ingresado aquí en el hospital en Estados Unidos. Ambulancia incluida. Espera, que te voy a contar. Bueno, intravenosa, $992, en realidad muchas cosas no sé lo que son, no sé qué, metabólica 580, él estuvo ingresado el día 17 del 2 y yo debería de haber pagado $6.210. Y ahora te voy a contar el gasto en ambulancia, que os recuerdo que la ambulancia no la pedí yo, la pidieron en un hospital para trasladar a mi hijo al otro hospital. Total, 893,12. La ambulancia y no sé qué rollos. Ya os conté que depende del seguro que tengas y del deducible que tengas, pagas una cosa u otra. En total tengo que pagar 271,79 y por la ambulancia tengo que pagar 145,87.
So it cost me $19,500 to have Misha here in good old America. And I'm here in Georgia, so I consider my health insurance to be one of the best that you can get here in the country if you are a full-time employee. And even then, I have a $5,000 deductible, and I still have co-pays at our doctor visits. Today, Misha is 6 weeks old, and her pediatrician wanted $110 today to measure her length and her weight. That's the benefit of living here in the United States, is going bankrupt by having a child. But in all seriousness, I'm ultimately grateful that I had a good delivery. no complications, easy vaginal birth. I was kept 48 hours in the postpartum unit after having Misha. That's just protocol. But yeah, $19,500. It's normal here in our great nation.
What was the cost of my doctor's visit in New York City without insurance? Don't forget to subscribe and I'll share the details. Once, I needed to visit a doctor in New York City without any medical insurance coverage. The most affordable option was to go to an urgent care center. These are small healthcare facilities staffed with general practitioners, often used for immediate medical care. I managed to secure an appointment for the very next day, completed the registration process, and consulted with a physician who prescribed me medications. This consultation cost me $250. Medications are not included. What are your thoughts on whether that's expensive or not?
Did it cost me a fortune to give birth to my son in America? I have the exact amounts I was charged. Let's talk about it. So for a little bit of context, I am born and raised in Northern Ireland where healthcare is free. I say free because you pay taxes, higher taxes, so it's not really free. But I had my first son in America and I don't have the bills, but I have a text that I sent my mum. It's on my computer screen right here, where I went into depth of everything that I was charged. So I wanted to talk through it with you. For context, I had a totally normal delivery and birth and a very healthy pregnancy. So this is going to be probably on the lower end of charges, to be honest. And I feel like that's going to shock some people. So this is not including any of my pregnancy appointments, and this is not including anything post-hospital. So any of my son's pediatrician appointments post the day we left the hospital. The first charge that I got was for room and board, which was $3,000. That is the most expensive hotel you're ever going to stay at. And I was only there for one night and I was out the next evening, early afternoon. I was charged $760 for medication, which I'm not sure what that was because that's not including the epidural. I did have an epidural. That must have been, I was induced at 7 o'clock in the morning, so that was probably for all the medication for being induced. I was charged $126 for lab tests, whatever the hell lab tests are. I was charged $1,000 for a recovery room, which I don't know what a recovery room is because I was charged the $3,000 for the room and board. I'll talk a sec, I'm charged for the labour room. So I don't know where the recovery room is because I was only in 2 different rooms. I was charged $3,900 for being in the labour room. Now, I was induced at 7 o'clock and I gave birth at like 4 p.m. So I was probably out of the labour room by 6 p.m. So I was in the labour room for less than 12 hours and was charged $4,000, like $3,900. It's wild. I was charged $1,400 for delivery. So I'm assuming just to deliver the child for my OGYN to come, I was charged $1,400. So that totals up to about $10,000, but my insurance paid most of it and I only had to pay $3,200. Like I said, that is not including my pregnancy bills. That is not including any tests I think that were done on my son in the hospital. I think that did come as a separate bill if I remember later on. So like that was just strictly for me to be in the hospital. I did think we got a bill for stuff that was done to him after, and that is not including medication I got when I left the hospital. I think I said it's not including the epidural, and that's not including any pediatrician appointments we had after. But I did text my mum that I said total, I think I paid about $5,500 for my son, which is actually not that bad compared to a lot of other stories I hear. And yeah.
I had a baby 2 months ago and I just got the hospital bill.
Okay, show us.
First thing is the labor room / delivery room, $13,900.
Was it a palace or a palace in heaven? For that price, it better be.
I got another bill that says room and board semi-private. That was $19,111.
Wait, they already charged you for the room. Now they are charging you for being inside the room. What is next? Charging you for breathing the air in the room?
The anesthesia, $2,181.
So you either pay $2,000+ or you take the pain. So McDonald's workers will pay 2 months salary or it is paid.
Pharmacy, $1,291.33.
Did they already charge you for medication? It feels like now they are charging you for the pharmacy just existing.
Other diagnostic services, that was $1,001. What is that?
They are charging you for order in application forms, the part you click when you don't know. They are charging charging you for that?
And then I got a charge for the emergency room, which was $411.
What? They charge this lady 3 times for room? Jesus Christ on the motorbike. So if these people wanted, they could just move you from one room to another and just keep charging you.
All those together, $38,757.33.
Jesus Christ on a motorbike for a baby. That baby better grow up to be Nelson Mandela or that baby will refund me.
Whew! I'm not done. I have like 3 more charges.
Say what?
Next bill is from US Anesthesia, and they charged me $13.56 and 68 cents.
But they already charged you for anesthesia before. At this point, they are just telling McDonald's workers you cannot have painless baby.
Delivery postpartum care, and that was $6,793.
But you could hire a nurse to take care of you for like 2 months for that amount.
The cervical dilator, which is the balloon that they put up there to induce my labor, that was $385.
And I bet they paid like $2 to make that medical balloon in China.
In total, it cost me $47,292.01 to have a baby.
Jesus Christ on a motorbike. At this point, is it even worth it to have a baby in America if you don't have insurance? No, it is not.
Hey, you're back. Hey, yeah, I am. Gosh, how's your leg? I heard what happened. Oh, yeah, no, it's so much better, thank goodness. Was everything okay at the hospital? Yeah, I have insurance. So. Oh, thank God. My friend broke his leg without insurance and he had to pay like over 20 grand to get surgery and everything. Oh my gosh. I didn't have to get surgery either, thankfully. Oh, so you just had to pay co-payments and co-insurance? Yeah, so like a few thousand. Oh, well, that's so good though. Yeah, that $560 for insurance every month really saved me. Hey, welcome back. Hey, thank you. How are you doing? How's your leg? Yeah, no, it's so much better now, thank you. I got all the treatments done, I got a cast put on, and I'm just doing the physiotherapy now. Oh, good. When's your next appointment then? Oh, yeah, that reminds me. It's 7:58 now, so I need to ring them in 1 minute and 32 seconds. Oh, yeah, I'll let you go then. Yeah, no, I need to change my appointment from the 24th to the 25th of June, 2024, so... Oh, yeah, you don't want to rush anything. Yeah. All right, speak to you in a bit. All right, bye, 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 bye.
Guess how much we pay for health insurance in California as a family of 4. But let me show you what's included first. As a small business owner, I selected Blue Shield of California because they have the biggest network and almost every good hospital is included, and even some acupuncture and chiropractic clinics. We have something that is called a full PPO, which means I don't need an approval to see a specialist, and I pay around $10 out of pocket per visit. And as you remember, I paid a bit over $2,000 for delivering a baby for a natural delivery. By the way, dental coverage is not included. We pay $787 for an adult, $520 for a baby, so in total for a family of 4, we pay $2,614 a month. How much do you pay in your country?
You want to know how bad healthcare is in America? Here's how bad it is. I get stitches, cut my finger the other day. Go into the hospital, get my stitches done. No big deal, whatever. I have to wait 2 weeks to get them taken out. In the meantime, I get billed for my visit. Before insurance, for 5 stitches, $3,800. After insurance, $1,800. Or $1,900, excuse me. After insurance, $1,900 for 5 stitches for a terrible hospital visit. Anyway, fast forward, so I get my bill and it's time to take the stitches out, so I schedule an appointment at the urgent care that is associated with the hospital that I went to, same company. So I schedule suture removal appointment online, and then I go in for the appointment and they say, sorry, we're not going to take those out. Since you got them done at the hospital, you have to get them removed at the hospital. I said, why didn't you tell me that when I scheduled the appointment online? They said, sorry, go to the hospital. So I go to the hospital. And then I wait around for a while in the ER, and then I get back and I ask the nurse, hey, this is what happened. They turned me away at urgent care, told me to come here, that you guys would do it for free. Is that true? And the nurse said, let me check on that. I'm going to check with billing really fast. So they go check on billing, and then they say, sorry, billing says that you'll have to pay to get these stitches removed. And I said, that really sucks because I paid $1,800 to have that done after insurance. And they said, that is absolutely ridiculous. And I said, I know. And then I said, gonna be honest, I'm not gonna pay any more money to the hospital because I already paid too much anyway. So I'm just gonna go. And I said, I think I might just remove them myself. And they said, that makes sense because that was so much money. So we'll just take you off triage. It'll be like you're never here. Don't worry about it. And then they were like, you know what? Let me just don't tell anybody we gave you this. And they gave me a little kit to remove my stitches myself. So that's a little story about healthcare in America. $1,800 will get you 5 stitches, and then nurses have to go behind the backs of the hospital to get you treated. So that's pretty stupid.
So this is a medical bill that we got back finally after about almost a year and a half. This is when my husband had to go to the hospital for COVID, and this is how much it was each time he got put in a room, I guess. So about $3,400 each room. This was all the medicine he had to take, which some of it being as high as $4,100, $1,800, $1,800, $1,800, $1,800. Crazy amount for all of his laboratory work, which continues on the back. More laboratory work, x-rays, and level 5 visit was $3,700. His oxygen, just to go to the ICU, about 20 grand. His physical therapy, $300. Anyways, this turned out to be about, for a grand total of $53,000, $854.69.
Are all hospital bills. So let's see what it costs to have a baby in America. First one is $100. Number 2, $7,000. Oh, $429.84. That's not so bad. Like shaking. I thought we owed $7,000. Number 3, $150 even. $1,371.70. Let me add up the total. $2,051.54. Now, I was curious what they charged my insurance, so let me go do that. My insurance paid $10,942.39.
Te voy a mostrar por qué yo prefiero ir al doctor cuando estoy en mi país, o sea, en Perú. Mira cuánto cuesta ir al doctor en Estados Unidos. Vamos a ver por acá. Yo fui al doctor porque tenía unos dolores musculares. Entonces, esta es la medicina que me dieron. El monto total, servicios de laboratorio que me sacaron sangre, orina, todo. 175, 337, no sé qué es. Obviamente es todo el descuento del seguro y aún así lo que yo debo es toda esta línea. Miren, esto lo que más me impactó a mí, me dejó diciendo que, aparte de todo esto que me han cobrado, la visita, visit al doctor, $3,592.47 centavos. $3,500, 3,600 pues. Con el descuento y lo que yo debo por la visita son $718. Me hicieron una radiografía, $430. Me salió a mí 86. Más medicinas para el dolor muscular. Y el servicio del doctor, como que si la visita no cubriera el servicio del doctor, son $385 de servicios de doctor aparte de visita, que me salió 77. Mi total es aproximadamente 1,500, me parece 1,300 sumando todo esto. Por eso yo prefiero ir a Perú a verme todo lo que es mis chequeos de rutina.
I've been getting bills for doctor's visits that Cigna's supposed to cover completely.
Huh, that's weird. The provider must have submitted the claims wrong.
Yeah, I wouldn't really know. Do you mind calling them and just sorting this out?
No, I don't really feel like doing that. Here's what you should do. Call the provider and tell them they have to resubmit their claims as EAP claims.
I have no idea what that means.
They'll know what it means.
Are you sure?
Yeah, definitely.
Hi, could you guys resubmit those claims as EAP claims? We have no idea what that means. They have no idea what that means.
That's crazy, man. Wow. Oh, well.
Could you just call them and figure this out?
I can't talk to them unless you're also on the line.
Okay, then we'll both call them.
I can't talk to you about this unless Cigna's not on the line.
Okay, I don't really know what I'm supposed to do.
We're just gonna send your bills to collections.
What? No.
2 weeks ago, I posted a video about how you can eliminate your medical debt. Since then, we've had thousands of people reach out for help, and we've already reported over $1.2 million of medical debt relief, and we're just getting started. Seriously, we are going to crush way more than that. So if you have any questions, let us know. If you need help, let us know. And just thanks for your patience through all this. It's been insane. And try to give our videos some love, because TikTok, we got posted as like a bot account or something because we were replying too quickly to everybody's messages. So they like flagged our account. So we're trying to get this info out there, but you know, swimming upstream. So love you guys.